Okay, so this is a PSA. I don't have time for any fancy stuff to do with the editing and all that, because I feel like I need to get this recorded and out there, as I think it's helpful information. I know that in our area, we've got school approaching and we have till tomorrow to go ahead and decide whether or not we want to enroll kids in a virtual distance type learning environment, or whether or not we are going to send them back part-time to school. And even though I've heard little blurbs and drips and drabs in the news about the airborne qualities of this virus, and for sure everybody's harping on masks, I have not found a concerted effort to try and communicate the findings that scientists are agreeing on more and more, pointing to the fact that the SARS-CoV-2 virus is primarily being spread through airborne transmission. Now, first and foremost, I am not a doctor. I'm just someone speaking to you on a video. Please, if you are getting information from anyone who is not a doctor, do yourself a favor and find the scientists and the doctors who are actually studying this virus and trying their best to communicate to the public how we can keep each other safe and how we can contain this and get everything under control. Unfortunately, one of the realities that we have is that we just do not have enough information getting out there and being promoted by centralized federal type public service announcements or scientific briefings, both on the federal and on the local level. But we also don't have the media. Well, I don't really know because I don't really watch the media, but I think from what I see, we don't have a whole lot of people in the media who are creating that space to put the most relevant information in terms of the health and science out there for us to absorb. So you're stuck with me, and let's just jump into it. I'm going to put links to all the studies that I'm going to talk about in this video down in the description. Please, if you're going to engage in any decision making or promotion or just speaking into anything regarding this virus and the health ramifications or the what we should do, what we shouldn't do, please go check those links, read them for yourself. There are lots of other studies out there that you can get to. There are lots and lots of information available online to get you a clearer picture of what we're dealing with here. I don't know why I feel like making this disclaimer, but there's no political motive or anything political that I have in this video. I'm simply a person that likes to follow the facts and the science and all that stuff. And I'm seeing a big void in this information getting across to the public. And so I'm just trying to do my little part as that geeky guy that looks at studies and does this just because he likes to. I'm doing my little part to try to share that with you in hopes that maybe it might help save a life or might just help slow the spread of this disease. We got to get it together. We have to get it together. We have to get it under control. We can do that. Other countries are doing that. Let's do it. You know, this may be a very boring video to a lot of people, and this is probably the most edgy thing that I'll say in the video, is that we all need to kind of suck it up and take personal responsibility to have the attention span to take in some of the non-sexy, glamorized stuff that we're constantly addicted to in the media. I should not have to make giant explosions in the background or show some scandal to get your attention. This is something I think that is maybe one of those problems in terms of why we're struggling to get the SARS-CoV-2 virus under control. And so please, just important information here. I hope it helps. Okay, so some of the indications in a nutshell that the virus is airborne is that there's general acceptance that the main spread is from droplets. Well, the focus has been on droplets in larger form, but anything that produces droplets also produces what's known as aerosols, which means airborne. There's been plenty of cases where the virus has spread to groups, even when social distancing has been put in place. And there's a huge prevalence of asymptomatic spreading. If you think about that, if we're told that the main transmission point is large droplets, well, large droplets occur when you cough and sneeze. Aerosols, on the other hand, occur through talking and just from breathing. And plenty of studies have shown that, on average, about half the cases that they're seeing and testing for are asymptomatic. And there's a good chance that since we are not testing everyone right now, that number is likely higher because most people are only getting tested when they're getting symptoms. One of the first big studies that put forward the notion that the virus spread on contact surfaces was a CDC study that was released on April 10th. That study looked at a lot of different samplings from hospitals in Wuhan. And what it did, it studied lots of different places to detect where the virus was within the hospital. So they took swabs of things like different contact surfaces in hospital rooms, in ICU, out in the hallway, in the bathroom. They even took studies and swabs of people's shoes. And interestingly enough, they found 100% of the shoes that they sampled in that study contained the SARS-CoV-2 virus. They also in that study detected the virus was in the air. But since the samplings of the contact surfaces were much more likely to contain the virus, that was overshadowed. One thing to consider is studies take time. Scientists just don't go out on a limb and put forth something as fact because it's just part of their nature to study and disprove things before they go ahead and release something as a found evidence of fact. And so a lot of these studies, even though it feels like we've been in the middle of this forever, they take months to go through the study. And then they take weeks or even months for a peer review of that study to make sure that it is sound and conclusive. So that CDC study from April 10th of this year said, we further assessed the risk for aerosol transmission of SARS-CoV-2. First, we collected air in the isolation ward of the ICU with 12 air supplies and 16 air discharges per hour, and GW, the general ward, 8 air supplies and 12 air discharges per hour, and obtained positive test results for 35% of ICU samples and 12.5% of general ward samples. Air outlet swab samples also yielded positive test results with positive rates of 66.7% for ICUs and 8.3% for general wards. These results confirm that SARS-CoV-2 aerosol exposure poses risks. Now, here's an example of studies and kind of how they take long to get to the point. This one is a National Institute of Health study that was released on March 17th, 2020. And featured in the New England Journal of Medicine, involved scientists from the CDC, the National Institute of Allergy and Infectious Diseases, and several university scientists. They tested the SARS-CoV-2 virus along with the SARS-CoV-1 virus and the MERS coronavirus to try to see if it had longevity in aerosol form, meaning that if they put the virus into an aerosol form, meaning that it was in a small, almost microscopic state, suspended in the air, and they kept it in that state, would it stay alive and would they still be able to measure it? The problem with this study is that they only measured for a maximum of 3 hours. And at the same time of studying this, they also studied how long the virus could live on contact surfaces because that was again, something that they wanted to pursue, going with the findings of how often they found it on contact surfaces in the past. So they studied the longevity of the virus on several contact surfaces and also aerosol, but the studies for aerosol were only for 3 hours. But they did find that the SARS-CoV-2 virus was viable at that 3-hour mark. And that led to a more extensive CDC study that was released on June 22nd of this year. Now, what they did in this study is they did 4 different studies at 4 different locations, basically the same study, but they just wanted to make sure that they had enough data from different people doing the study. So they did this in 4 aerobiology labs, one in Tulane University, another at the National Institute of Health Research Facility in Maryland, another at the U.S. Army Medical Institute of Infectious Diseases in Maryland, and another one at the University of Pittsburgh. And they took timed interval readings from samples at 10 minutes, 30 minutes, 2 hours, 4 hours, and then again at 16 hours. Some of the results of that study said that the airborne SARS-CoV-2 maintained the expected morphologies, size, and aspect ratios up to 16 hours, suggesting the potential to be infectious after long-term aging in aerosol suspension. Our approach of quantitative measurement of infectivity of viral airborne efficiency, augmented by assessment of, I'm going to mess it up, virion morphology, suggests that SARS-CoV-2 may be viable as an airborne pathogen. Humans produce aerosols continuously through normal respiration. Aerosol production increases during respiratory illnesses and during louder than normal oration. A fraction of naturally generated aerosols falls within the same distribution used in our experimental studies, less than 5 microns, which leads us to conclude that SARS-CoV-2 infected persons may produce viral bioaerosols that remain infectious for long periods after production through human shedding and airborne transport. So what that means in normal speak is that basically the virus kept shape. They looked at it with powerful electron microscopes before they injected it into the aerosols and then after at the different sampling points. And they found that it kept its shape, meaning that it didn't degrade or mutate. The virus was still in its original form in intervals that they studied up to 16 hours. The other thing to take away from that study is just a clarification that normal respiration, when you talk or when you breathe, produces aerosols within the size that they were looking at in that study. Now, another study the National Institute of Health released on June 13th was a really broad study of air transmission concepts. Basically, this study kind of encapsulates a lot of studies that have been done in the past with other coronaviruses and also just other viruses in general. There's lots of particular details in this study if you want to take a look at it. They're based upon where you are and if or not you're wearing a mask. And they've got some details on what the air transmission looks like in a car, in an airplane, or in a hospital ICU. They really tried to cover everything. And another thing that they wanted to define is the characteristics of the droplets and aerosols based upon the size, meaning that there might be different effects based upon the size of the particles and how that affects the transmission in terms of how far it can go and the different path that it might take. In that study, they found aerodynamic diameter of 20 microns or 10 microns or less should be reckoned to be aerosols based on their ability to linger in the air for a prolonged period and the reachability to the respiral fraction of the lung. Small aerosols are more susceptible to be inhaled deep into the lung, which causes infection in the, I knew I was going to have to say it, alveolar tissues of the lower respiratory tract, while large droplets are trapped in the upper airways. Many believe that droplets predominate over aerosols in terms of contracting the disease. Thus, over time, research work has been focused on acquiring better knowledge on the science of droplet transmission. However, since the recent past, evidence has been provided to refute the former hypothesis and speculated that aerosols also play a major role in transmitting the disease. What I found from this article as well as others is that the 2-meter social distancing rule actually comes from studies in 1934. See, what happens when we cough or when we sneeze, we form large droplets. Those large droplets haven't been able to be studied until recent times, the past couple decades, because we simply haven't had the technology to look at things at the molecular level required to adequately do those studies. So a lot of the studies that we actually draw upon are from the 30s, 40s, and 50s. And when a large droplet comes out of your mouth, it's heavy enough that it falls on the ground. So that's why they're looking at the 2-meter rule. This is a lot different than aerosols that can remain in the air and circulate for much larger distances. In general, there exists an accepted notion of a 2-meter safe exclusion zone to prevent possible droplet transmission from an infected person to a susceptible host. However, there are no comprehensive studies to support such a phenomenon. A study in 1934 has supported the 2-meter exclusion zone concept, taking into account the evaporation falling curve. That same study has postulated that large droplets over 100 microns will fall to the floor within a horizontal distance of 2 meters from the source. Other studies also have proven that when an infected person of a respiratory illness coughs or sneezes, a cloud of pathogen-bearing droplets of different sizes appears to come out and travels even up to 7 to 8 meters from the point of source. Moreover, recent experiments conducted after COVID-19 contagion by the study and by that study have been in agreement with the findings of this study and that study that have reported that pathogen-bearing droplets of all sizes can travel for almost 7 to 8 meters during sneezes and for more than 2 meters during coughs. So again, the notion of the 2-meter distancing comes from a long time ago, almost 100 years ago. Since then, there have been numerous studies that have revisited even how those larger droplets fall. And what they've found is that sneezing can propel some of those larger droplets as far as 7 to 8 meters, and coughs can propel those droplets as far as 4.5 meters. And again, we're talking about large droplets here. We're not talking about aerosols. So when we're talking about guidance for social distancing, we are not talking about distancing that helps with airborne transmission or aerosols. And we're also basing that on studies from 1934 that have since been refined. And that's not to say that social distancing is not important. Social distancing is important because the further you are away from someone who's infected, obviously, the more spread those particles have, the less chance you have to get infected. But one of those questions you might ask is that, well, if social distancing at 2 meters isn't exactly far enough, well, what kind of tool in our tool bag do we have that could be the primary way to fight the spread of this disease? Well, there's a good study done by the National Academy of Science released on June 30th of this year. It attempts to show the case that the virus is primarily being spread through airborne transmission. And based upon studies that they took from data in New York City and Italy, that the use of masks is the most significant factor in controlling the spread of the virus. From that study, face covering prevents both airborne transmission by blocking atomization and inhalation of virus-bearing aerosols, and contact transmission by blocking viral shedding of droplets. On the other hand, social distancing, quarantine, and isolation, in conjunction with hand sanitizing, minimizes contact transmission, but do not protect against airborne transmission. With social distancing, quarantine, and isolation in place worldwide and in the United States since the beginning of April, airborne transmission represents the only viable route for spreading the disease when mandated face covering is not implemented. Similarly, airborne transmission also contributes dominantly to the linear increase in the infection prior to the onset of mandated face covering in Italy and New York City. Hence, the unique function of face covering to block atomization and inhalation of virus-bearing aerosols accounts for the significantly reduced infections in China, Italy, and New York City, indicating that airborne transmission of COVID-19 represents the dominant route for infection. And so now if we're looking at airborne transmission, which scientists refer to aerosols, it would be important for us to consider that field of study that specifically deals with aerosols. WebMD featured an article on May 27th. That article cited Kimberly Prather, a doctor and scientist, who suggested more research is indicating that the primary spread of COVID-19 is in fact airborne. She runs a large government-funded research center at the University of California in San Diego, and she studies how viruses and other things that come out of the ocean float in the air. So one of the other things with aerosols is that aerosols are also produced, in addition to normal human respiration, they're also produced when liquid is basically stirred up. So whenever you flush your toilet, it produces aerosols into the air. That's why you smell the poop in your toilet. They've done lots of studies as well on the aerosols produced from sewage. That's another thing they're looking at. Those are indicating that there is virus spread from those aerosols as well, but they've got more research to do, and that's not what I'm really trying to focus on right now. Since she primarily deals with aerosols and airborne contaminants, she's a great resource. I'm going to link a description below of a good interview with her on YouTube that I highly recommend you check out as well. In that article, she says, I have to say something because this could actually protect people, she says. What airborne transmission means, she says, is that 6 feet is not far enough to stand apart. It also means we should probably be wearing masks a lot more often. She points to the success Taiwan has had stopping the spread of the infection. Taiwan has only had a few hundred cases and only 7 deaths, even though the country never implemented a national lockdown. Instead, they aggressively tested their citizens, quarantined people who tested positive for 2 weeks, and had everyone wear face masks. If you look at countries that just naturally wear masks when people feel sick, those countries did a lot better than those that did not. And it's supposed to say Prather, not Prather. On the fly, folks, on the fly. Now, in that article, she references a study, again, going back to how long it takes studies to come out. That article was published May 27th, which means that, interviewing her and stuff probably took place before then because everything gets reviewed. The same article that's referenced in that May article wasn't released as a study till late June. June 26th to be exact, and it's from the American Association for the Advancement of Science, and it's on reducing the transmission of SARS-CoV-2. From that study, it says aerosols can accumulate, remain infectious in indoor air for hours, and be easily inhaled deep into the lungs. For society to resume, measures designed to reduce aerosol transmission must be implemented, including universal masking and regular widespread testing to identify and isolate infected asymptomatic individuals. I'm going to stop right there for a second. So it's not only the masks. I know a lot of people are saying, well, everybody's wearing masks. Well, everybody's not wearing masks. That's besides the point. But the other thing is widespread testing. Yes, per capita, we've got a lot of widespread testing here in the United States as of now, but we're still not testing asymptomatic people. And so if asymptomatic people are spreading this airborne, then what scientists like this are proposing is that we need a lot more testing to identify those individuals in order to contain the further spread of the virus. A study in hospitals in Wuhan, China, found SARS-CoV-2 in aerosols further than 6 feet from patients, with higher concentrations detected in more crowded areas. Estimates using an average sputum viral load for SARS-CoV-2 indicate that 1 minute of loud speaking could generate over 1,000 virion containing aerosols. Assuming viral titers for infected super-emitters with 100-fold higher viral load than average yields an increase to more than 100,000 virions in emitted droplets per minute of speaking. Calculations predict that in still air, a 100-micron droplet will settle to the ground from 8 feet in 4.6 seconds, whereas a 1-micron aerosol particle will take 12.4 hours. Measurements now show that intense coughs and sneezes that propel larger droplets more than 20 feet can also create thousands of aerosols that can travel even further. Increasing evidence for SARS-CoV-2 suggests the 6 feet CDC recommendation is likely not enough under many indoor conditions where aerosols can remain airborne for hours, accumulate over time, and follow airflows over distances further than 6 feet. I hope all this information helps you to get a better grasp on some of the nuances of the virus and understand why, hey, we're doing these things and this is continuing to happen. We're doing this and that's continuing to happen. Well, one of the things that we have failed to get to is to a point where everyone is wearing masks. Me personally, from reading these types of studies, it encourages me to wear masks and seek out better masks for not only the prevention of me spreading the virus, but also the prevention of me contracting the virus as well. Please feel free to share this video. The only thing I ask is, like, don't share it, don't comment on it with the idea that it is advancing any political narrative one way or the other. This should not be a political thing. Pretty much most of the world is not treating this as a political thing. They're treating it as a health crisis, which it is. So one of the ways I do that with certain things like this is, like, if you're going to share the video, you simply share it and maybe put a comment on it on your share that says something like, interesting information talking about studies that show the virus is airborne. It's data-driven, it's scientific. We don't have to make this sexy, we just have to share the information. There's a good chance that I'm going to follow this up with some more detail. I really just want to get this information out there in case you weren't aware of the airborne stuff, and the fact that the biggest concern should be right now is the potential that if you're in a room or an indoor setting with multiple people, there is a heightened risk of infection because it's primarily airborne. We're not saying that or promoting that as a concept because we're still on the whole idea that this is contact-based or large droplet-based, but scientists are finding the contrary, that it's airborne. So some of those things that we need to look at, for those of us who are in positions of influence, that means that, you know, we need to be talking to those places that we are going to be inside of, making sure that we've got certain filters in place, like a minimum, I think, New York State had recommended a minimum of a MERV 11 filter, air filters. So looking at the air filtration systems and where we have a lack of ability, certain air filtrations in buildings don't have the ability to put certain air filters in place. And so is there a way that we can adapt those air systems to be able to put filtration in place? If not, can we put filters? Can we get temporary filters for filtering out the air and circulating it, getting it fresh air in and out? Open up windows, open up windows and get air flowing in and out, so you don't have the air just being self-contained. You've got fresh air coming in. These are all things that a lot of folks in these different studies are advocating for. A big thing, if we consider that it is airborne, is that, again, we have so many asymptomatic cases, and one of the things that scientists have really been at a struggle to figure out with, well, what do we do? Like, if somebody does not present with symptoms for 7 days, but yet they're carrying the virus, why is that happening, and how do we combat that? Well, the thing is like, if I'm asymptomatic, I'm still talking and I'm still breathing. And so only those who are symptomatic are going to be coughing and sneezing and propelling those larger droplets. But anybody who's asymptomatic is still going to be talking, and they're still going to be breathing. So it's really important to kind of consider that. And how do we effectively treat and manage those indoor spaces with that consideration, that we have no real way? We can't take somebody's temperature to determine if they've got a viral load that's going to spread, in that closed room over the course of an hour and infect everybody. We don't have a way to gauge that. All we can do is we can do those things that help to limit and ensure that that spread is contained as much as possible. If you made this far, thanks for sticking with me. I know that was probably really boring, but for some of you, I hope that was eye-opening. My goal every time I do a video is just to reach one person. So if I did that, I made my goal. And thank you. Stay safe. I hope you've learned something from this. I hope that you take time out of your daily life to meditate, pray, learn, and grow. And we can do this, people. I know that it's challenging. I know that it's hard. And I know that we've got to do lots of things that we've never had to do before. But we can do this. We can get through it, and we can get over the other side of this. So take care.